seems to be taking its time. Oh, we're now live. Let me just double check and make sure that we are live for our exciting Paloma Health special event for the last day of Thyroid Awareness Month. Yes, we are actually getting ready to, it looks like we are getting ready to start to go live here. So I am Mary Shomon, and I'm a patient advocate, and I do some work with Paloma, helping them on understanding various patient issues. And so I'm very excited to be here, and we are going to be talking about how to lose weight when you're hypothyroid. And so we've had some great questions that have already come in from viewers, and we are going to have time for you to ask some questions as we go. And you are going to get to ask the amazing Dr. Linda Goggin, who is one of our favorite docs at Paloma. We love all our docs, but Linda is just so wonderful about sharing her time and her wisdom with thyroid patients and people that are really struggling to get those hormones under control. So let me tell you a little bit about Dr. Goggin when we first get started. She is one of our doctors at Paloma, and Paloma, of course, is a virtual medical practice. We are one of the only dedicated to hypothyroidism, hormonal health, and now weight loss support for people with thyroid issues and in perimenopause and menopause. And so we encourage you, if you're not familiar with Paloma, to learn more about Paloma, and you'll hear a lot more about what Paloma does today from Dr. Goggin and myself. But Dr. Goggin is a board certified family medicine practice physician with extensive experience in and training in functional medicine and complex medical illness. And anybody with a thyroid issues trying to lose weight knows that that can be complex. She has a very special interest in hypothyroidism and healthy weight management. And she works with many of our Paloma patients to really dive deep into the root causes to help them manage their hormonal symptoms and enjoy better health. So we are so very excited to have her join us today to talk about some of the reasons why it is a challenge to lose weight when you're hypothyroid and some of the solutions. So our goal is for you to go away today from this live event with practical ideas and approaches that you can make so that you can make this year the year that you get that underactive thyroid and weight under control. And believe me, we've all been through this, almost all of us. I have. Took me a while to figure out what it was going to take to lose 50 pounds that I had gained when I first became hypothyroid. And it can be very, very frustrating for many of us. So this is the topic we thought would be a helpful one for Thyroid Awareness Month, which is January. And again, we're coming up right to the end of it. So we wanted to make sure that we went out with a really exciting opportunity to share some really valuable information that's going to give you some things you can actually think about starting to do today. So as I mentioned, we have a few questions to get us started. But we will have a point during the presentation for you to ask your questions. So feel free to put your questions into the YouTube chat box. I'll be periodically going over there to check on those questions, and we'll be covering many of them later in the presentation. So as I said, we had some great questions that already came in, and so we've got those teed up and ready to go for Dr. Goggin. So the first question really is for you, Dr. Goggin, to tell us, just from your own standpoint, why is this issue so important to you? We know it's something that you focused on, but why is it an important one for you?
Right. Well, this is something that throughout my career as a family doctor, and now, I've been a family doctor a long time before I became a functional medicine doctor and a thyroid specialist, that everyone has issues. I mean, it is ubiquitous. People wanting to release weight, finding it difficult, and especially when it's combined with hypothyroidism, it can make it doubly difficult. And I feel like there's just not enough tools out there for people. So many times they're told, "Oh, just eat right and exercise, and just take this levothyroxine," and they're not heard. And that's why Paloma was created. Really, was so that we could hear where people are and use out of the box, more creative solutions that are more geared towards each individual person. And I think that's something, even me, when I've gone to the doctor, there have been times when I didn't feel like they actually heard what I was trying to say during the time that I was sick. And so that's what's nice about Paloma, is that we really are able to listen and focus in on each person. And in America right now, we have an issue with weight gain. And personally, as a functional medicine doctor, I feel like this is related to a lot of things. One of the things is the food supply, the lack of really clean food, probably endocrine disruptors coming from the environment, and toxins that are adding to our problems with our endocrine systems. And so that's why I want to advocate for all you guys, uh, trying to live as clean as you can, not using plastics, going to glass containers. These kinds of things are going to make it less likely that you will have endocrine stuff in the future. And so that's one of my big messages is trying to live as clean as possible, with reducing toxins, and then addressing the root cause. And for many people, Hashimoto's, that's the root cause of their thyroid issues. And when we try and help people release weight in combination with treating their thyroid appropriately, we get some magic happening. So that was a long answer.
No, that was exactly what we wanted to know, because it's obviously an issue that you're passionate about. And 30 years as a patient advocate, and having had to battle the weight issue myself with hypothyroidism, it's an issue that I'm very passionate about. So we share that, and I know that there's a lot of viewers and patients who are equally passionate about this as well. Um, okay, so let's start out with our first question. Um, a lot of our viewers have said, "Hey, what do I need to know about the connection between Hashimoto's, hypothyroidism, and weight gain?" Because a lot of folks don't really know. They go to a doctor and the doctor says to them, "Oh, you might gain a couple pounds when you're hypo, but it's no big deal, and you'll lose it when you get back on meds or when you start your medication." And so it's very often downplayed, and people don't realize that there is a very definitive link between having autoimmune thyroid, having an underactive thyroid, and the issue of weight gain or difficulty losing weight. So, what can you tell us about that challenge?
Right. Well, so Hashimoto's, as many of you probably know, it's an autoimmune disorder, and it leads to chronic inflammation, and it's related to chronic inflammation in the body. And over time, your body actually attacks your thyroid gland, and this leads to underactive thyroid or hypothyroidism. And what we see in folks who have hypothyroidism from Hashimoto's is this high level of inflammation, which makes reducing inflammation from different approaches very important part of how we treat Hashimoto's. The other thing that we see with Hashimoto's and hypothyroidism in general is that people will have a lower basal metabolic rate. So their metabolism, even when they're adequately treated, can be downregulated. So fewer calories will be burned when they're resting. They also can have a slower metabolism of fat, which can lead to fat accumulation, and their carbohydrate metabolism. That's how we use our food, right? We burn it up for energy. But all of these different types of metabolism can slow when someone is hypothyroid. They also can have fluid retention and weight gain. And sometimes it creates an issue with difficulty losing the weight later. Like it comes on and then it's harder to get rid of. And we may even see an increase in weight from just fluid of up to 10 pounds. The other ways that Hashimoto's can impact your weight release is that it can slow your digestion. And when your digestion is slow, it can cause things like constipation, bloating, and these can contribute to problems with weight release. We also see changes in how in our appetite, whether or not our appetite is normal. And so we can get something called leptin resistance, which can reduce the signals our body gives us to tell us that we're full. And so when we think of all these different things that can go into creating disruptions in our metabolic health, and then we think about, well, gosh, what if there is stress? I mentioned stress at the beginning. When our stress is higher, which honestly isn't that normal life, right? Our stress can be high. When stress hormones are high, we're going to have, we can have dysregulation in our weight release. That is, our body under stress says, I don't want to lose weight, right? And it tries to hold on to weight. And so, even with treatment, sometimes we see challenges with weight release. There are nuances with the thyroid hormones. That is, our thyroid makes inactive T4, and that has to be converted into active T3. And sometimes, if we're under stress, that conversion doesn't happen. And so we might have a totally normal TSH. I know that's one of the things we're going to talk about, how the TSH is not the only way to look at the thyroid, but these conversion issues of turning your inactive into active thyroid can also help prevent weight loss. And so we really want to optimize your thyroid hormone levels, both T3 and T4, reduce inflammation and reduce cortisol by managing stress and making sure that you've got all the nutrients that you need, right? You need selenium, zinc, iron, B12, vitamin D. You need all of these to help support good thyroid health. And then the other important thing is we look at it hand in hand with weight release and gaining muscle. Well, and this is, I can't, if there's one thing y'all need to take home, is that this, as to get metabolic health, if you think of it more in terms of getting strong rather than releasing weight and changing body composition, this is a very healthy way to approach weight release, to think of changing your body composition. So anyone who comes to me, whether we're talking about thyroid or whether we're talking about weight release, I am going to point them towards resistance training and adequate protein. So, oh gosh, I know I'm kind of going all over the place, but we want to reduce inflammation, balance metabolism, optimize thyroid hormone levels, and make sure that a person's blood sugar is also being regulated. So there's a lot of things that go into and may block weight release in someone with Hashimoto's. And so it's like juggling a lot of balls. That's why I think you need somebody who's done that before to help you, because it can be tricky.
Well, and you mentioned something that's interesting to me, which is the issue of blood sugar. And we know that people with Hashimoto's and hypothyroidism are at a higher risk of metabolic syndrome. And we're also at a higher risk of developing type 2 diabetes. And I've actually seen it described in like medical textbooks as people with hypothyroidism sometimes have what they call a deranged metabolism. And that term always cracks me up because I don't think of, metabolism in the terms of deranged, but what that really means is what you're talking about. All these different pieces of the puzzle
Yeah,
are all destabilized, right?
yeah,
So
yeah.
tell us a little bit more about sort of the importance of blood sugar issue for us, because it's really a key player in the inflammation and the weight loss issue, isn't it?
That's so true. Well, basically, many people that I see have something called insulin resistance. That is, their body's making a lot of insulin, but they cannot adequately use it to get glucose into cells, and this can contribute to weight gain over time. So, insulin resistance is really one of the big things that we're battling, and if we have high stress, it makes it even worse. So we are going to look at ways that we can balance the thyroid, right? Optimizing that thyroid treatment and making sure that that's good. And at the same time, many times I'll even suggest someone do a continuous blood glucose monitor, even if they're not diabetic, so they can see what food does to their blood glucose levels. It's interesting to hear people come back to me, and this is something you can actually get it. You can get a free trial for 2 weeks from different blood glucose monitor companies, but they'll wear it on their arm and then you wave your cell phone over it and it will tell you immediately what your blood glucose is.
Hmm.
So you can say, okay, I just had a piece of cheesecake. How is my blood glucose? And I've had folks who have run this experiment and found that there were certain fruits that made their glucose go really high, whereas there were other things that they thought would be a problem that weren't a problem. So, getting glucose managed is very important. And I know it's going to probably segue into our next question about what kind of things might we use for doing that. Because many times we're talking about people who don't have diabetes or maybe have just a few elevated sugars. How can we help those people to get metabolically normal? And that's what I'm asking myself when I'm talking with people. It's like, what does this person need to get metabolically normal?
Mhm. Well, it's interesting you mentioned the continuous glucose monitor because I'm a type 1 diabetic. And so for the last 5 or 6 years, I've been using a Dexcom, which, and I think the one you're talking about, like the one that has the free 2-week trial is the Freestyle Libre,
Uh-huh, yeah.
which is out there. And that's very similar in a lot of ways to the Dexcom. But when I first got the Dexcom, I was just astounded at some things because there I'd be 10 o'clock at night. I'm hungry and I want a snack. And so what do? I go and I get a banana. And I think a banana is healthy. It's a piece of fruit, right? I'm going to do
Right.
a banana. I eat the banana and it shoots my blood sugar up 100 points. And which I also tested it out. Same thing a chocolate bar would do to me. So, from the standpoint of my
Right.
blood sugar, a chocolate bar and a banana were basically having the same impact on me.
You're
Now,
right,
of
right.
course, nutritionally, they have a different impact, of course. And maybe the banana has a little more fiber or something. But the bottom line was that sometimes things you think are very healthy, even that bowl of green grapes, depending on how your body is handling it. And like you said, whether you're insulin resistant or what's going on with all of those other hormones, even something as healthy as a bowl of fruit can actually contribute to weight gain if it's eaten at the wrong time of day, or if it's not matched with protein, or if you eat too much, just simple overconsumption of these things. But
Mhm.
then I would discover things like as I learned to test with it, and I always recommend when I'm doing coaching with people, I tell them too, even get a finger stick glucose meter if you don't want to get the CGM, and test things after you've eaten them. Because then I found out I could eat a bowl of strawberries and have a very minimal impact on my blood sugar.
Yeah, right.
So certain fruits that are lower glycemic, foods that are lower glycemic have a definitely different impact, but people will respond differently. Some people will
So true.
skyrocket on rice, other people do okay, that type of thing. So I think it's like for me, I get kind of wonky about it, but I get so fascinated by how everyone's physiology is different and we all respond differently to these carbohydrates. And
Yes.
we have to find the formula that kind of works best for us.
Right. So true. It is so true. What works for me may not work for you. And sometimes we have to try a few different things before we find the aha that is what will work for each of us.
Hmm.
I mean, when we think about weight release, there are already. I mean, there's so much buzz out there, right? Intermittent fasting, which can be for some people very appropriate. I like the book Fast Like a Girl. I think that's a great book because it gives you several options. Or Fast This Way. Dave Asprey's book also gives several different options. Um, so changing what you're eating is what everybody kind of tries. But the question is, how can we maintain and live a life with still including festive events and that sort of thing. So that's when our nutritionists at Paloma are very helpful with helping people find that balance and finding what works for each person, while the physicians are helping trying to balance the hormones. Sometimes even moving into medications, right? If diet and nutrition are not meeting the needs of the individual. And
Mhm.
that's when we say, well, should we try something to help with curbing the appetite, or some of these medications that I know you guys are hearing about, right?
Right,
Yeah.
exactly. Well, we've sort of touched upon a few of the things, but I want to see if you can kind of give us an overview again, just for people who are still just in the process of joining us, because we've got more people coming in every moment. What is the real foundation for healthy weight loss or weight release for people with Hashimoto's or hypothyroidism? And if you had to pick one particular first step that's the most important for you in the process, what would it be?
Oh, it's interesting. It's probably not the step that you would think, but it is trying to manage stress. Okay. Because when our cortisol is high and we are under a lot of stress, all of our efforts become less effective. So that I would say lowering stress is more important than people imagine. Okay. The next thing that I would say is, oh, okay, so so that would be the first thing.
Okay.
So that was what you asked me. And then beyond that, we're going to move towards those things everybody thinks of, like changing what people are eating. I tend to suggest lower carb for people, something like the AIP, the autoimmune paleo style of eating, or even the ketogenic style or low carb can be extremely healthy. Like I say, one size does not fit all, but there are different levels of intensity of the ketogenic style of eating. But both AIP and low carb are really reasonable things to try. We can change the timing of our eating. That is, condensing our the time in which we eat into a smaller length of time, so that's intermittent fasting, right? Maybe push breakfast out a little bit and try and not eat at least 3 hours before bedtime, and understanding that all of this requires that we do physical activity. And for many people, they're overdoing it on the cardio is a thing I see a lot, because cardio, when you're doing very intense cardio, can actually raise cortisol and block that weight release. So making sure someone's doing resistance exercises is can't be overemphasized, because when people lose weight, if you're not doing resistance exercise, you are going to be losing. Sorry, my dog. Hey, it's okay.
He said,
Yes, this
"Yay,
is
yay.
real life.
Take me for a really good power walk for some resistance exercise," right?
Right, right. So if we don't do resistance exercise, people are going to be losing both muscle and fat, not just fat. And then people can become what we call skinny fat instead of getting more toned and more fit. And this
Mhm.
is especially true with the weight loss medications, is that we see people are can lose muscle mass, and so actually doing resistance training is critically important to that. So,
Well, let
yeah,
let me ask you a question to clarify something, because
yeah.
not everybody necessarily knows what the definition is of resistance training.
All
So
right, right.
let's explain what that can mean, from something as simple as things I could do in my house versus more
Right.
elaborate or going to a gym or working with a trainer types of things.
Okay. Well, so the first thing is you don't have to go to a gym. Gyms can be fun and they can be motivating, especially if you have a group that you're working with or a friend or a trainer, but you don't have to go to gym to do resistance training. In fact, it can be body weight exercises, like using, there's an app called Seven that gives 7 minute workouts. So it can be body weight exercises. You can purchase a kettlebell, which is great resistance training at home, a kettlebell. And it can be as simple as isometrics, even, especially if you're going from nothing to something. Isometrics are great. And it's been shown that you can actually increase muscle mass and strength by just doing like a 3 to 4 second maximum contraction of a muscle over the course of several weeks, doing that a couple times a week, and you will actually grow in strength and muscles.
Mhm.
So it doesn't have to be super complex, but it is pushing against resistance. So, right. So
Ooh,
I have a countertop. I can lift up against a countertop with my hands and contract my biceps, and I'm doing resistance exercise. Likewise, I can push down on it. So the next time you guys are doing your dishes, right, you could just stop what you're doing and you could do some resistance training right there at your counter. And if later on in the show notes we can put, I've got an isometric training, like 5 exercises, rotating different muscle groups every day that I can add for the folks that are listening.
Oh, cool. That sounds great. Um, I have to add my favorite, sort of very basic starter type of thing, and it's what I often will do and work in, and I will often tell people who are very sedentary, just even start with this, are stretchy bands.
I
Um,
love it. Yeah.
I love stretchy bands, and I leave them in different places around the house. So, like, if I'm going and I'm heating up a cup of tea, so it's 3 minutes in the microwave, I pull out the stretchy bands and I'm, stretching up and down,
I
and
love it. I love it.
I'll put it under my foot and I'll do some leg lifts or whatever because it's like because that's dead time anyway. So I figure every minute adds up. And
Yes.
that's the thing I think that people don't always understand is you do not have to say, I'm going to dedicate 45 minutes a day to doing this. You can do 3 and 4 minute uh, pieces of this throughout
Right.
your day and work it in to do when you take a break, when you go into the bathroom, when you're brushing your teeth, do some, tight muscle tighten your glutes, do some different, there's lots of ways to sort of sneak in this fitness type of activity.
Yeah.
And but stretchy
Love
bands
it.
are like one of my favorite go-tos because they make me feel like a kid a little bit, they're kind of fun.
Yeah. I love sneaking it in. I mean, I tell people who are doing no exercise at all,
Mhm.
just when you rise from a chair, do it a few times. And it's like a squat, right? When I
Sure.
stand up and sit down, stand up, sit down.
Mhm.
So the other thing is when they evaluated people who were working at a hotel who were cleaning rooms, and they told half of them how much calories they were burning, and they said, hey, this is actually exercise what you're doing at work. And
Mhm.
then the other half, they did not say anything. The people who they told, hey, this is actually exercise, that group lost weight. And so part of it is in how you think about it, and if you recognize that every little thing that you do. Now when I have to move, like from like I have to go pick up the mail at the
Mhm.
mailbox, I'm gonna jog to the mailbox because it feels good to move my body,
Mhm.
and nobody's making me do it. And it is a tiny, I like to call them exercise snacks.
Yeah.
It's an exercise snack, right? That you can do. So
Mhm.
get those snacks in.
Well, and that's perfect for people because I am not a big fan of going to the gym, and I'm not a big fan of doing a lot of exercise.
Right.
But I can get 30 minutes in 5-minute bites as I go
Yes.
through the day, and
Yep.
then I don't feel like I spent a big chunk of time. I just squeezed it into various things where I would have been standing around or not really doing much of anything anyway. So I even have put like we'll put sometimes I'll put a couple of 3-pound hand weights, and if I'm going to watch some TV, I'll just sit and do some crunches on my arms, just
Love
because
it.
it's like dead time anyway. Might as well get some use out of it, right?
Yeah, I love it. That's great.
Um, okay, so here's the question that I know a lot of people are going to ask us because I've heard it for 30 years, and I know you have too. We've got thyroid patients that say, I optimized my thyroid treatment. So they've worked with a doctor like you or someone outside of Paloma or another Paloma doctor, and their thyroid levels are optimal and they've cut back on their calories. They're eating pretty clean. They're trying to do very well with that, and nothing is happening. In fact, in some
Yeah.
cases, I was talking with a woman who was a personal trainer. So she was working out like 30 hours a week because she was working out with her clients and, very physical job, eating about 1,400 calories a day. And she
Mhm.
was gaining like a pound a week. And she said, what do I do? I'm going to rip my hair out. And so, what do we do when we're in that situation where we're like, honestly, nothing is working? I'm defying science. I've actually heard people say, how can I possibly not lose weight with what I'm doing? And yet they don't. So, what's
Yes.
going on and what can we do to help those people?
Well, one thing that I'd like to mention is that there are toxins that are out there that can cause weight gain where people feel they tick all the boxes for hypothyroidism.
Mhm.
And the toxins that I'm speaking of specifically are mold. So you want to make sure you're not living in mold. That's a whole nother topic.
Mhm.
But for those who have already done, you know, done all of the things and they've regulated their thyroid, sometimes we do pull out weight loss medications in order to give people a leg up. There's a lot of controversy around, are the GLP-1, so that's when I think of weight loss medications these days, I am thinking about those GLP-1 agonists because they do seem to be quite effective for many people. And are they the right thing? And could they help me? I think a lot of people are wondering that. Are they safe? Um, and so there's some unpacking to do around like the GLP-1 receptor agonists. And you guys might have heard of these like semaglutide, which is also called Ozempic or Wegovy. Tirzepatide, Mounjaro, Zepbound are very commonly used now. And this is something that how these guys work, right? Is they are very similar to a peptide that you make in your body that helps regulate blood sugar and appetite. But but what's in your body that you make only lasts like a blink, right? It's here and gone. And over the past, couple of decades, these were actually discovered quite a while ago, but they didn't know how to make it last in the body. And initially it was a diabetes medication. So now they've changed the peptide that you make in your body very slightly so that it lasts longer. And initially it was made for regulating blood sugar, right? And then they saw that when they pushed the dose of these GLP-1 agonists, that people, lo and behold, were losing weight. But that seemed to be limited by certain side effects. So I'm kind of launching into talking about GLP-1s, but I guess you didn't officially ask me about that.
No, but that's good because that is certainly one of the
Yeah,
key questions that we wanted to talk about, and we're actually
yeah,
getting questions from some of our viewers. Clark said, "What do you think of Wegovy in terms for hypothyroid patients?" So this is
right.
exactly the kind of question. Like, I mean, do they work for everyone? And are they good and safe and an option for people with hypothyroidism who have done all the homework? They've got the thyroid in shape. They're doing some resistance exercise. They're practicing some stress management. So they're getting all their ducks in a row, but it's still not making a change in the weight.
Yeah. So we have to weigh the risk and benefit of taking the medicine with the risk and benefit of carrying the extra weight in terms of our mental health, our heart health, our longevity, and so when I hear people rail against them, and I hear people that love them, for me, it feels like it is a tool, and for some people, it's the right tool. Um, uh, so, uh, so let me first just talk about with hypothyroidism. Uh, there are not any contraindications to trying these medications with hypothyroidism. I really like to see that someone has already tried some other things, right? They've tried to, uh, you know, do some resistance training and go low carb, sort of tried a few things, because if they aren't willing to change what they're eating at all, then if they don't just continue taking the medicine forever, the weight will come back, right? So that's something we see, is that if somebody just eats a standard American diet, right, that's the acronym SAD,
Mhm.
and they take, Zepbound, Wegovy, they're going to lose, well, many will lose weight, okay? However, if they keep the way that these medications work is by reducing your appetite, so you stay fuller, you sort of feel fuller faster, and you stay full longer. They slow the movement of food through your GI tract, and they can help improve the pancreatic release of insulin and suppress glucagon. So they really do help you have a more normal blood sugar level and not feel as hungry. So that's basically how they're working.
Mhm.
Um, and if you go into that and you're just eating eating crummy food and you just eat less crummy food, you are going to not come out a healthier person, right? Because you are not nourishing yourself adequately. So the people need to be getting the nourishment and have this idea that I'm going to use this in conjunction with good lifestyle. And those are the people who are going to be really successful, right? So we start to think about, well, where are you going to put that resistance exercise in? Okay, where are you going to put the stress management?
Right.
Right? How are you going to find substitutes for the favorite foods that you got to have, right? That so that you have something that works with your body instead of against it. And I mentioned this at the beginning of like resistance training. You absolutely have to be doing resistance training. Otherwise, when you lose the weight, we see with all of these GLP-1s that you're going to be losing 25 to 40% of fat of muscle. So some of it's fat and some of it's muscle. And if you don't do resistance training and eat adequate protein, so you can't just eat nothing. If you just eat a bag of chips a day, you're going to lose weight, but you're going to feel bad. So you must have adequate protein resistance training so that you keep your muscle, lose the fat as people are going into GLP-1s. And so I think that it's a mindset thing. You have to walk into this going with eyes wide open. I'm going to be making a revolution in my life. I'm moving towards health and moving towards habits that are going to help me stay healthy and feel good for a long time. And those are the people that are going to be successful. If you go in thinking, well, I'll just take advantage of the reduction in appetite, everybody gets that. As soon as you stop that Zepbound or stop the,
Back.
Ozempic, it's going to come right back, and it'll probably come back as fat. And so you will be less healthy. So I'm sorry, I get a little passionate about like the
No,
resistance
it's a good
training. It's so
it's a
important.
good point, and I'm gonna say what you didn't say, which is that this is why people are complaining about Ozempic face and Ozempic butt, because it's all over
Mm,
social media. It's like, "I went on Ozempic and now my face is like, falling, or my butt is all saggy and wrinkly looking,"
yeah,
and things,
you
and
lose the muscle that's holding it up.
exactly,
Yeah, yeah,
exactly. And so people need to understand that that is the Ozempic face and the Ozempic butt as a side effect is not a guarantee, especially if you're doing good things like eating enough protein and practicing some resistance exercise. And
hmm,
one thing that I found is helpful for me, and I'm not doing these drugs, but I found it helpful in general, just being at my age, is adding some good collagen sources into my
oh
diet,
yeah, yeah.
because that really helps my skin stay, a little bit more intact at this point in life, and I mean, is that something that you think would also be helpful for people who are in a weight
Absolutely.
loss program and working with a GLP-1 drug?
Yes, collagen hydrolysate would be my suggestion.
Mhm.
And it's been shown to help with a lot of things, even with joint pain. So it's
Yeah.
interesting. That is one of the supplements that I take, collagen.
Yeah, me too, and
Um,
it's great for hair too. I love it
yeah,
for
yeah,
hair.
yeah. So I mean, I think that if you go into it with the right attitude, the other thing that people are talking about online is this microdosing of the GLP-1 agonists, and that is something that I'm very interested in the lowest effective dose. Right. So this is something where pharmaceutical companies they want us to use a bunch of their drug, but does a person need a very high dose to
Mhm.
have a therapeutic effect? Not necessarily. And I think that's interesting. There are different ways that we can access these drugs because the expense is a thing. Mary, have you heard about how much these things cost?
Oh, I know. I mean, if you're paying cash price for these, they're 1,200, 1,500 a month. A lot of people are having to lay out for them.
Yeah, so that is what's interesting is the um, the patents on these very expensive drugs that where they can charge a ton of money is really more on the pen. Okay, so the pharmaceutical companies have created a delivery system, um, but the medication itself is not as expensive. And right now, it is possible to get much less expensive uh, tirzepatide and semaglutide that are compounded, and it is the same medication. So
Mhm.
it does add this added, like, well, I got to draw it up out of a syringe. Yeah, you got to do that. And so for some people, they're like, well, if it can be paid for, just get it paid for by your insurance. But lots of people, it's just not covered. Usually, it will be covered if someone has BMI of a certain, has a certain amount of weight and another comorbidity. So, like high blood pressure, high cholesterol, heart disease, these
Already
kinds of
type 2
things.
diabetes in some
Type 2
cases.
diabetes, of
Yeah.
course, yeah. So
Mhm.
these are medications for diabetes. So,
Right.
yeah. So diabetes will get you the medication covered if you have weight in conjunction with that.
Mhm.
But for the people that it's not covered, the compounded versions can be a very safe option, and people can see a lot of great weight release with compounded medications too.
Mhm. And,
Mhm.
we'll put in a little bit of a plug, for Paloma specifically here, because this is one of the interesting things that Paloma has recently expanded into is working with our patient community, to provide weight loss solutions, including GLP-1s. We're also, some of our doctors are also working with their patients using Contrave, which is a
Mhm.
medication that combines, Wellbutrin, the antidepressant, with very low doses of naltrexone. And some people have had success with that. We've also seen some people work with metformin. But obviously the GLP-1s are the ones that everybody's kind of talking about and interested in right now. And Paloma has worked with a very specialized compounding pharmacy to combine the GLP-1 medications with some additional nutrients to kind of really supercharge them for people with thyroid disease, for energy, and to get into that mitochondria of the cells and really energize them. So, and those compounded medications are actually amazingly affordable for a lot of people, because again, I don't know anyone who's taking a GLP-1 who's got it covered by their insurance. So almost everyone's paying out of pocket. So Paloma's options, Paloma worked very hard with the pharmacies to get the best possible price for patients. So we're happy to discuss this further. And you can find on our membership page, you'll see a breakdown of some of the different options to join Paloma to get, whether it's just basic thyroid care all the way up to a complete metabolic overhaul because you're perimenopausal or menopausal, you got to lose weight and your thyroid's out of whack. And so you need all the help they got. And even then, it's so incredibly affordable. And you get access to doctors like Dr. Goggin. And who doesn't want that? I'm going to switch over to a few questions because we've got a bunch of them coming in, and I want to make sure before we wrap things up that we cover these questions. Emma had a question that is actually one that often comes up because it's one of the warnings that you hear on TV about the GLP-1 drugs, which is the small but measurable risk of thyroid cancer that's associated with the GLP-1 drugs. So she wants to know do I need to be worried about this? And if I've already got thyroid nodules, does that mean like I really should be worried? Is it, what kind of a risk are we really looking at with this? Because it's my
Right.
understanding is it's pretty small.
Right. Yeah. So it's important to recognize that the issue with thyroid tumors has been shown in rats, right? So it's in rodents, and whether or not that could happen in people hasn't yet been shown.
Mhm.
It's not really clear. However, if you have a family history of what we call multiple endocrine neoplasia type 2, it's contraindicated. But the thyroid tumors have not been shown in people. But it is important to recognize there are some other side effects. One is pancreatitis, right? So if someone has had um, gallbladder disease, gallstones, or pancreatitis, we really want to think twice, think carefully. If you've had pancreatitis, you shouldn't take these medications. Okay, But because rapid weight loss can lead to a gallstone, and that's how you get pancreatitis is a gallstone comes down and blocks the duct, and then you get the inflammation. So we don't want you to have gallstones either. And sometimes when we lose weight rapidly, that can um, uh, cause gallstones. But the thyroid tumors, it's less of a thing unless you have this family condition called multiple endocrine neoplasia type 2. So, I mean, the big side effect everybody hears about is this dose dependent nausea. It can be even further than that. Some people will have nausea, vomiting, diarrhea, constipation. And this is one reason why I think starting very slow on the dosing is extremely reasonable,
Mhm.
because we see people who have side effects. The side effects can go away with time. And I will often give somebody a little bit of Zofran to help with that.
Great. We have a question from Maria Rose, and she said, "Am I crazy for thinking that carbs are causing my weight gain? I feel so bloated." And this is a good question, and because it's one that I think I know the answer to it, but I want to hear what you have to say about it.
Well, there's a difference between healthy carbs and less healthy carbs. And for some people, they're carb sensitive, and carbs will cause their weight gain. I mean, it can be part of it, right? So there's this sort of continuum, and part of it has to do with who's living in your gut, right? What's your microbiome like, and whether or not you have the ability to digest and use, and you have microbiome that's working with you. So if you're wondering, are carbs my issue? I think it is always worth trying a healthy low carb diet. So that includes some healthy carbs, which basically comes from non-starchy vegetables, right? Those are carbohydrates, right? Your salad, even greens, these are carbohydrates, but they are non-starchy. And so eating a lot of non-starchy vegetables, and going lower on the grains, sort of mean and green, or lean and green, lean, mean, and green, could be a way to test your hypothesis that carbs are an issue. And people, make sure if you're going to try going lean and green that you are staying very well hydrated. Those first few days can be a little challenging, but after you get through that, if you start to see a release of both the diuresis, release of water, and
Mhm.
release of weight, you might be somebody who is carb sensitive.
Oh.
So, but I'm curious, Mary, what you were thinking. Is that kind of what you were thinking too?
Um, yes, I think, I know for a fact that if I overdo it on starchy carbohydrates or sugary carbohydrates, I am going to gain weight, or I'm certainly not going to lose weight. I mean,
Yeah.
nobody loves a giant bowl of pasta more than me, but a big bowl of pasta and a piece of garlic bread it's just I'm going to feel so bloated because I also am a tiny bit. I don't have celiac disease, and I don't even have the full on gluten sensitivity, but I'm a little bit sensitive to too much gluten. So when I overdo
Mhm.
it, I'm just a bloat festival, and
Oh,
I don't
yes.
I don't lose weight. Now if my dinner instead is a grilled chicken breast or a grilled piece of steak and a big salad and maybe a little bit of sweet potato, I'm gonna feel very different, and I mean, I could have 2 pounds up or down on the scale in the morning depending on what I ate for dinner the night before in terms of just overall, like, fluid retention, all of those types of things. So, I think the idea of doing a little trial of
Yes.
cutting back some of the carbs and see, and this is also where the continuous glucose monitor can come in too, because you
Mhm.
can also see what does your glucose do after that bowl of pasta and the garlic bread compared to
Yeah.
chicken breast salad and bit of sweet potato? And you're going to see what the differences are in the way your body responds, and that also affects the overall success of the weight release. But my question for you now kind of segues into one of our other questions from, let's see, who is this? Is from Lisa McMains. She wants to know about supplements, vitamins, and herbal supplements that might help with weight gain and even joint flare up. And so one of the first things that I'm thinking of, because whenever I'm feeling extra bloated, what do? I go extra on probiotics, because if I get on a good probiotic and I double it up a little for a couple days, that completely gets rid of the bloat for me. And so tell us, what do you think about probiotics, and what other things do you feel are really important for thyroid patients to be aware of when they're trying to lose weight?
Yeah. So I love that you bring up the probiotics because there is a specific probiotic that has been shown to help with both weight loss and glucose control, and that's Akkermansia. The Pendulum Company makes, they do a lot of education around this, so you guys can look up Pendulum Akkermansia. Uh, and that has been shown to be low in people that are having weight issues, and it can improve both your metabolism, your blood glucose balance, and help with weight loss. So that is, I strongly encourage people to go with fermented foods so that they're continually feeding their gut buddies, right? Um, and other supplements that we see that could potentially help. I like to think about both lowering inflammation and improving that gut microbiome and improving energy. So beyond fermented foods and probiotics, I feel like fiber is very important. But it's critical that you go gently with fiber, so that you don't get the bloat, right? And but understand that if you eat fiber at the beginning of a meal, you're going to slow that glucose spike that you would typically get later
Mhm,
on. So I suggest people begin the meal with fiber. That can mean beginning with fiber supplement or beginning with your salad and veggies at the beginning.
mhm.
And there are some supplements that we see can help with, with lowering inflammation. Curcumin being my very favorite because it helps so many things. A lot of us have aches and pains, and curcumin has been shown to be very effective at helping multiple different pathways in a good way. So it's like an adaptogen, moving things in a less inflamed manner. So I love that, especially if you have aches and pains. What I want to mention, like the big thyroid nutrients that we always will look at, making sure people have enough vitamin D and zinc and B12. These are critically important. Selenium too, although I see that selenium less frequently as a deficiency. But the B vitamins are very important. Make sure you have enough of those because um, if your cellular machinery can't work right because you have a deficiency, it is even harder for people to release weight. There's a few others that I think about. Green tea extract has been said to increase fat oxidation. And so drinking green tea, a lot of great stuff in green tea for you. I think we're hitting the high points. Those are probably the big ones that I think of.
Right. Great. Well, I'm going to cover one more question from one of our viewers, and then I think we're going to wrap up because we're coming up on the end of the hour. And actually, this is a question that kind of came in the same form from two different viewers. Um, uh, Angela wanted to know about the carnivore diet. Like, what do you think about that? And then Hannah said, I eat a lot of animal protein as part of my low carb diet, which is essentially the carnivore diet. Do you think that that's safe and healthy? So, what's your take? People still think back to Atkins and the steak and bacon, everybody just eating bacon and steaks and high fat meat all the time. What's your take on meat as a important part of a low carb diet for some people?
Yeah, so I have seen people who swear by the carnivore diet. And it's interesting because when we look at the research, it seems to suggest that a vegan diet is most healthy, right? You look at Michael Greger and his movement. However, there are some people that have like either there's allergens in other foods or there's foods that cause inflammation in their system, and removing them all using a carnivore diet can yield results, yield improvement or reduction in inflammation. Because what do we do when we go on a carnivore diet, right? We're taking out all processed foods. We're taking out sugar. We're taking out seed oils, which are bad for you, grains, dairy, right? In general,
Yeah.
you're taking all these things out. And if you have an autoimmune condition, sometimes that can be very helpful. And when we have a higher protein intake, we feel more full. And the absence of carbs will lead to a reduction in those high insulin levels too. So it also is kind of easier for some people. It's easier, right? You don't have to make a bunch of decisions, right? You're just trying to eat animal protein. And I encourage anybody who's doing a carnivore diet to try and eat as clean protein as they possibly can. I know sometimes that is expensive, but we do see some people having dramatic improvement in digestive issues using a carnivore style of eating.
Mhm.
Um, and I mean, I think that the cons, well, you're missing out on a few things, right? You're missing out on like vitamin C, not as much fiber. You're missing out on polyphenols that we know have an influence in turning on good genes.
Mhm.
So there's a few things like magnesium, potassium, folate that are harder to get from that diet. Some people will get constipated on that diet. Some people love it, others not, right?
Yeah.
And depending on your cholesterol balance, it could cause issues with elevation in triglycerides. I mean, we can't go to the cholesterol talk yet though, because it's like almost 6 o'clock.
We'll do that another time.
Another time we do the cholesterol
Yeah.
talk. Oh my gosh. So some people it works great for. I mean, I know that is true, and I don't think the carnivore diet suits everyone. And I think probably people do better when they have a little more fiber and some veggies for the general population. If I had to give everybody some advice,
Sure.
but if you feel great on that carnivore diet, more power to you. Honestly,
Mhm.
that's how I feel.
I hear you. I hear
Yeah.
you. We had one last question, and it was from Nayla, and she basically said, "I don't know if I am Hashimoto's or hypothyroid. So how do I know which diet to follow?" And they always seem to be specific to one or the other. And I'm going to jump in here first and say, first of all, Paloma has a very convenient, easy to do home test kit that will test your thyroid function. Oop, we lost the doc. What happened to the doc? She got disconnected. Well, anyway, we have this amazing uh, home test kit, and it includes a Hashimoto's antibodies, the thyroid peroxidase antibodies testing. And so it's a very, very simple way to find out if you do have Hashimoto's or hypothyroidism. And then, of course, you can work with one of our Paloma doctors or a doctor from another area with your test results to get treatment. Okay, here comes Dr. Goggin back into the picture. Here she is. There we go. We got her back.
I don't know what happened.
You just looks like you just got disconnected for some reason. I've just been telling them about the Paloma home test and that they can get their thyroid levels and the all important thyroid peroxidase antibodies to help
Yeah.
differentiate for Hashimoto's. And I believe if you use the coupon code YouTube, so those of you who are watching us on YouTube, you can use the coupon code YouTube and you can get $30 off that thyroid test kit or $30 off a new membership with Paloma Health. So this is a really great opportunity. And before we wrap it up, I do want to just mention, as I said before, Paloma has a variety of levels of membership. You can get at the basic level for hormone rebalancing for your thyroid and your perimenopausal or menopausal health. There's a weight care essentials level, which includes access to these GLP-1 drugs that Dr. Goggin is talking about. Then we have the metabolic reset, which combines support for thyroid, weight, and perimenopause and menopausal health all together. and then the complete health boost, which is sort of the gold plated process. And that is full wellness for your thyroid, your weight management, perimenopause, menopause, and you get to work with some of our health coaches who are really great at providing you that additional support. As you can see, talking with Dr. Goggin, this is the type of approach that most of our Paloma doctors really embody. They have a very direct, patient-oriented approach. They'll talk to you like you're a human being and an intelligent person, and they're very passionate about getting you to feeling well. And then our coaches come in and help you sort of sort through all the little questions. Oh, we lost Linda again. Something's going on. Her connection's unstable. In any case, I wanted to mention that. So go to Paloma Health, www.palomahealth.com, and check out our membership link. And here we go, back again. Oh, yeah, something's unstable in your connection.
Sorry, I want to speak to Nyla,
Okay,
who's
go.
for what diet advice. The AIP is a super healthy way. In fact, the AIP I suggest for people who are working on memory loss or trying to reverse Alzheimer's. So that you can't go wrong with the AIP, the autoimmune paleo. So Nyla, maybe that's helpful to you.
Yeah, great point. Because
Yeah.
basically, if you eat, clean, avoiding those pesticides, avoiding the hormones in the food, trying to go with organic fruits and veggies as much as possible, emphasize those lean proteins, grass fed, that type of thing, and stay away from too much with the grains and the sugars. And that's an anti inflammatory. In many ways, an AIP or an autoimmune protocol diet. And for those of you who want to follow the AIP diet to the letter, because it can be a bit complicated and things, but it has incredible results for autoimmune patients, we have a free app that you can get at the App Store for iOS and Android, and it will walk you through a 12-week program to learn how to follow the AIP diet at every step of the way. And of course, those health coaches I mentioned, they also can work with you one-on-one, hand in hand, on how to implement these types of approaches into your daily life. I think we're going to go ahead and wrap it up. So I want to thank you, Dr. Linda Goggin, for sharing all your wisdom and all your information, and your compassion for patients is just, I don't know. I think everybody watching can feel it. And
Oh, Mary.
and I love that. I really love that. And you're telling us, well, we lost her again. Something's going on with her connection. But Dr. Goggin is telling us like it is. And she really is a good example of the type of doctors you're going to find at Paloma, and they're going to make you really your partner. They're going to become your partner in getting well, living well, feeling well. So I'm going to go ahead and wrap this up and invite anyone to continue to ask questions on this thread. Check back every week. Topics related to almost everything about weight loss that you could possibly wonder about. And check it out. There's so much resources and so much information at Paloma Health. And if you become a member, you have access to our incredible doctors and this exciting new program for weight loss and access to GLP-1 drugs. So happy Thyroid Awareness Month, and do your part, spread the word, tell your family and friends to be on top of things and keep track of their thyroid. And when it comes down to it, my wish for everyone is may you live well and feel well every day. So thank you very much for joining us tonight. And hopefully we will see you again soon for another Paloma Live event. Thanks, everyone.